Good day, everyone. I am Charissa May C. Daculan from BSN 3B, and with me is Miss Daculan&Morales from BSN 3D, and we are going to discuss the von Willebrand's disease. Von Willebrand disease is a genetic disorder characterized by a deficiency or dysfunction of von Willebrand factor, which is a crucial protein involved in homeostasis and thrombosis. Von Willebrand disease is the most common inherited bleeding disorder affecting approximately 1% of the global population. The disease was first described by Finnish physician Erik von Willebrand in 1926. The von Willebrand disease is caused by mutations or deletions in von Willebrand factor gene, leading to impaired platelet adhesion, aggregation, and blood clotting. This disease is inherited in an autosomal dominant pattern, meaning that a single copy of mutated gene is sufficient to cause the condition. Prevalence: 1% of the global population is being affected, and females are more affected due to the hormonal influences, and symptoms often appear during childhood or adolescence. Now we will go to the signs and symptoms. We have the bleeding symptoms, which includes the easy bruising, the nose bleeds, heavy menstrual bleeding, prolonged bleeding after an injury or surgery, petechiae, purpura, and hemarthrosis. On the laboratory findings, we have prolonged bleeding time, decreased von Willebrand factor antigen and activity, decreased factor VIII activity, and on the diagnostic test, we have laboratory test, which includes the von Willebrand factor antigen assay, von Willebrand factor activity assay or the restositin cofactor, the factor VIII activity assay, the bleeding time, the platelet count, the prothrombin time or the PT, and the partial thromboplastin time or the APTT, and genetic testing for suspected familial cases.
Okay, so hello everyone. This is Morales Deborah Melica from BSN 3D. So let us now come to the pathophysiology of the von Willebrand disease. Now, as we can see here, von Willebrand disease could either be inherited or acquired. So I will be discussing the inherited part, while Ms. Daculan will continue to discuss later the acquired. So when the von Willebrand disease is inherited through the autosomal dominant inheritance, it could result to either type 1 or type 2. So when we say type 1, it is the partial quantitative VWF deficiency or the von Willebrand factor deficiency. So quantitative, meaning there is a reduced amount of von Willebrand factor in the blood. But when we say type 2 or the qualitative deficiency, the impaired VWF function, it means that there is a qualitative deficiency where the von Willebrand factor doesn't work properly. Now, when the von Willebrand disease naman is acquired inherited from the recessive inheritance. Now, when the von Willebrand disease naman is inherited through the recessive inheritance, it could lead to type 3 von Willebrand disease or the complete quantitative von Willebrand disease deficiency. So it means that there is an almost total lack of von Willebrand factor in the blood. So, what I good. Okay, so going back to the type 1 von Willebrand disease or the partial quantitative von Willebrand deficiency, it results to the decrease in von Willebrand factor quantity or function, which compromises the blood's ability to clot effectively. And then when that happens, it results to a decrease in the binding to von Willebrand factor specific antibody or immunoassay, as there is less von Willebrand available for these tests to detect, which, as we can see here, results to a decrease in von Willebrand factor antigen assay, which measures the amount of von Willebrand factor and confirms its low levels, which then again results to an increase in bleeding or prolonged closure times, meaning that the wounds take longer to heal. And when that happens, it could progress to spontaneous hematomas, or the sudden formation of large bruises or blood collections under the skin without significant trauma.
Acquired von Willebrand syndrome is not inherited but rather an acquired condition, often linked to underlying health issues such as autoimmune disorders or clonal lymphoproliferative diseases. This acquired nature differentiates it from the congenital form of the von Willebrand disease. And this acquired condition results to the presence of antibodies to von Willebrand factor in autoimmune. In autoimmune diseases, the body mistakenly produces antibodies against the von Willebrand factor, and these antibodies target the von Willebrand factor in the bloodstream, impairing its natural function in blood clotting. And this immune response is a common trigger for acquired von Willebrand syndrome. Results for antibodies to bind and activate existing von Willebrand factor. The antibodies that target the von Willebrand factor may bind to it directly, causing either inactivation or activation. In some cases, these antibodies increase the tendency of the von Willebrand factor to interact with platelets or with endothelial surfaces, leading to rapid degradation or clearance. And other result of the acquired is the clonal lymphoproliferative disease. In clonal lymphoproliferative diseases, for instance, in certain leukemias or lymphomas, abnormal immune cells proliferate uncontrollably. These diseases often produce autoantibodies, including those that target the von Willebrand factor, which further compounds the von Willebrand factor dysfunction and enhances the bleeding tendency. Results for antibodies to bind and activate existing von Willebrand factor. The antibodies that target the von Willebrand factor may bind to it directly, causing either inactivation or activation. In some cases, these antibodies increase the tendency of the von Willebrand factor to interact with platelets or with endothelial surfaces, leading to rapid degradation or clearance. Other result of the acquired is the clonal lymphoproliferative disease. In clonal lymphoproliferative diseases, for instance, in certain leukemias or lymphomas, abnormal immune cells proliferate uncontrollably. These diseases often produce autoantibodies, including those that target the von Willebrand factor, which further compounds the von Willebrand factor dysfunction and enhances the bleeding tendency. And this results to the absorption of von Willebrand multimers into tumor cells. Tumor cells in clonal lymphoproliferative diseases can absorb the von Willebrand factor multimers, which are the larger, more active forms of von Willebrand factor essential for proper clotting. And this absorption removes the von Willebrand factor from the bloodstream, reducing its availability and function in normal homeostasis or blood clotting. And this results into increased plasma clearance to the von Willebrand factor, because the binding of antibodies and the absorption of the von Willebrand factor into tumor cells can lead to increased clearance of von Willebrand factor from the bloodstream. And this results in a depletion of functional von Willebrand factor, which is necessary to control bleeding effectively. Consequently, patients with these conditions may experience spontaneous bleeding episodes due to the lack of available von Willebrand factor. Deficiency, or the decrease in quantity and its function. The von Willebrand factor is crucial for blood clotting. A deficiency, whether in the amount of the von Willebrand factor or in its functional effectiveness, impairs the body's ability to stop the bleeding efficiently. The von Willebrand factor normally helps stabilize clots by binding to other clotting factors and platelets. And this results to the decreased von Willebrand factor available to bind to damaged blood vessel collagen. The von Willebrand factor plays a critical role in clotting by binding to collagen exposed at the blood vessel injury site. This binding action helps the von Willebrand factor anchor to the blood vessel wall, which serves as a scaffold to attract the platelets to the injury site. With von Willebrand factor deficiency, less von Willebrand factor is available to bind the collagen and facilitate this process, thus weakening the formation of a platelet plug. To the bleeding symptoms, because the inability to form a proper platelet plug leads to the various bleeding manifestations, which are the characteristic of the von Willebrand deficiency. First, we have spontaneous hematomas. Without sufficient von Willebrand factor, bleeding can occur spontaneously into tissues, leading to hematomas, or what we call bruises or blood-filled swellings. And these hematomas may form with minimal or no trauma, as the blood vessels are more susceptible to breaking without adequate clotting support. We have bleeding from mucosal surface. Mucosal tissues such as those lining the mouth, nose, and the gastrointestinal tract have many small blood vessels and are particularly susceptible to bleeding. With impaired clotting, the minor injuries to these tissues can lead to prolonged and sometimes spontaneous bleeding episodes. As we have easy bruising, the bruising occurs when the blood leaks from the capillaries into the skin or soft tissues. In this, without proper von Willebrand factor function, even the minor impacts can lead to significant bruising, as the lack of effective clothing means that the small bleeds do not seal off quickly. Tendencies described above often manifest as first the menorrhagia or the heavy menstrual bleeding. The von Willebrand factor deficiency leads to heavier and more prolonged menstrual bleeding in women, as the blood vessels in the uterine lining are unable to clot effectively during the menstrual cycle. Second, we have the epistaxis, or in layman's term, it is called nosebleeds. The delicate blood vessels in the nasal mucosa are prone to bleeding. In individuals with von Willebrand factor deficiency, these vessels bleed more easily and for longer, leading to frequent or prolonged nosebleeds. Lastly, we have the gum bleeding. The gums which contain a high density of small blood vessels are prone to bleed with even minor trauma, for instance in toothbrushing, because the von Willebrand factor deficiency exacerbates this condition, causing excessive or prolonged gum bleeding. Factor deficiency and decreased quantity and its function. The depletion of the von Willebrand factor leads to a functional deficiency. This means that either the amount of the von Willebrand factor is sufficient or the available von Willebrand factor is defective, impairing its role in stabilizing blood clot formation, which result in a decrease in the von Willebrand factor's ability to stabilize or carry plasma factor VIII. The von Willebrand factor also has a critical role in stabilizing and protecting factor VIII in the bloodstream. With reduced von Willebrand factor, there is less binding and transport of factor VIII, leading to its degradation, which further result into a decrease in plasma factor VIII. Factor VIII levels drops as a result of inadequate stabilization by the von Willebrand factor, and this further compounds the bleeding risk factor since the factor VIII is crucial for the clotting process. Lead to impaired intrinsic pathway of the coagulation cascade. The deficiency in the von Willebrand factor disrupts the intrinsic pathway of coagulation, which relies on a series of interactions between clotting factors to form a stable blood clot that will further result into increased time for blood clot formation and elevated partial thromboplastin time, or the PTT. Due to the impaired coagulation, It takes longer for blood clots to form, as measured by an increased partial thromboplastin time or PTT, which reflects a delay in clotting within the intrinsic pathway, further leading to increased risk of severe hemorrhage. The impaired clotting mechanism leaves the patient at a high risk of severe bleeding, particularly in cases of trauma or spontaneous bleeding events.
Okay, so let us now proceed to the medical management of the von Willebrand disease. Now, number one, we have desmopressin or DDVAP. So, desmopressin is a synthetic hormone used to treat mild to moderate von Willebrand disease. So, it stimulates the release of stored von Willebrand factor and a factor 8 in the body, which helps to control the bleeding. Second, we have the von Willebrand factor replacement therapy. So, the von Willebrand factor replacement therapy involves the infusions of the von Willebrand factor concentrates to replace the missing or defective proteins. So, it ensures proper blood clotting when natural levels are too low. Third, we have the antifibrinolytics. So medications like tranexamic acid or aminocapproic acid slows down the breakdown of blood clots, making them useful for preventing excessive bleeding during surgeries or injuries. Okay, so fourth, we have hormonal therapy for women. So oral contraceptives or other hormonal treatments can regulate or reduce the heavy menstrual bleeding in women with von Willebrand disease. Okay, fifth, we have topical hemostatic agents. These topical hemostatic agents are applied directly to the wound to stop the bleeding. So they accelerate the clot formation at the site of the injury. Okay, next is the nursing management. So for the nursing management of the von Willebrand disease, we have here assessment, prevention of injury, patient education, and the preparation for surgery or dental procedures. Now, for the assessment, of course, we will have to monitor for signs of bleeding, yung mga obvious like easy bruising, nosebleeds, gum bleeding, mga ganon. Then we will have for women, we are going to check for the changes in menstrual patterns. Just like with what Ms. Daculan have said earlier, mas madali siya or mas obvious, mas madali ma-diagnose yung sakit in women because yung mga babae, meron silang buwan ng dalaw. And then we are going, of course, to assess the patient's family history of bleeding disorders. Okay, second is the prevention of injury. So, of course, we will have to educate the patient on avoiding high risk activities like contact sports to reduce the risk of injury. And then we are going to ensure the patient avoids medications that may worsen bleeding, such as NSAIDs and aspirin, or yung mga medications that are blood thinning. Third, we have patient education. So we have to educate the patient about the disease, of course, its inheritance, the importance of informing healthcare providers about the condition. And then we are going to teach them the signs of bleeding that require immediate medical attention. And fourth, the preparation for surgeries or dental procedures. We have to ensure the patient receives appropriate prophylactic treatments like desmopressin, like what I have mentioned earlier, desmopressin or von Willebrand replacement before procedures that may trigger bleeding. Okay, so when you have von Willebrand disease, we can anticipate for the following complications. So first, we have here anemia, severe bleeding episodes, surgical risks, and life-threatening hemorrhage. Finally, for the prognosis of the von Willebrand disease, with proper treatment and management, most individuals with von Willebrand's disease can lead normal lives. However, if left untreated, the disease can lead to significant health risks, especially in severe cases where life-threatening bleeding is a potential complication. Okay, so that is all for our report. Again, this is Miss Morales with Ms. Daculan. Thank you and have a nice day.